I'm Dr. B Varun, surgical gastroenterologist. Today, I'm going to speak about a very common, the most common gastro problem, what we are facing worldwide and even in our country. So, I'm going to talk about acidity. So, acidity, in the lame terms, means bad digestion. Is there any abdominal discomfort or indigestion, or is a common term what we use for any abdominal problem we have? So acidity is a very, very common problem, which we see around 30 to 40% prevalence is there. That is 30 people out of 100 are suffering with this problem at any point of time. So when it is significant, so commonly you get it at once a month or once a year, but you're having a persistent symptoms for more than 4 weeks of abdominal discomfort, any burning sensation in your stomach or your abdomen, or any early satiety or any vomiting sensation. This is called as acidity. The next thing, what is called is a reflux syndrome. So acid is actually formed in the stomach, which is needed for your normal digestion. It's a very protective function and helps in a digestion. But what happens is because of our food habits or any other problem or your general health problem, your acid production increases. It increases when you take any meal. So that's the reason any irritation further increases acid digestion. And this acid digestion stays in your stomach in a normal person. But when you have any irritant or any other problems, which I'll be telling you about the reflux, which releases your sphincter, that is a junction between your abdomen and your chest. Then your acid comes into your chest, and that is called a gastroesophageal reflux disease, or we commonly call as reflux disorder. So that is actually a part of the acidity problem, and that has to be tackled along with acidity. So majority of the acidity problem, 30% have a known causes. That is, they can be treated with medications or any other intervention. But 70% are functional problems where you have to follow some dietary modification or a lifestyle modification, which I'll be telling further. The common causes, what I'll be telling you is the first is irregular food habits, which is very, very common in any person, even myself or any person you take. What happens is because if you are skipping a meal, like you're skipping the most important meal of breakfast or lunch, your acid in your stomach actually increases. And in that, because of you're skipping a meal, you became very tired and your glucose levels come down. Then you tend to take a fatty or a oily item, which actually gives us instant energy. That actually irritates the stomach very badly, and that is very, very common cause of their acidity. And the main problem is not only irregular food habits and the timings also. So in every person who is working in the night shifts or working for a day and night shift or traveling out stations, or they have to unfortunately skip a meal or take irregular meals, there the problems of your irregular food habits or some outside food may actually cause irritation in stomach, and that causes your acidity. Followed by very common cause is your weight gain or obesity. So obesity, what it causes, because of your intra-abdominal fat content, your stomach is pushed back and front. So that is the reason actually obesity is a very common cause for gastroesophageal reflux disease. So that has to be tackled. Otherwise, the symptoms will actually aggravate, and there will be a further worsening of your condition. Followed by pregnancy. Pregnancy is a physiological cause. Any abdominal discomfort or any abdominal distension causes your stomach to push forward and cause any discomfort leading to indigestion. Some food items causes your acidity or your reflux. Commonly, smoking. Smoking is a very common cause, and the nicotine in it relaxes your sphincter, which causes severe reflux disease. Smoking, alcohol, tea, coffee, chocolate, peppermint, and citrus fruits like tomato or any grapes that may be causing a severe gas problem or your acidity for you. Some other causes may be there, which may be diagnosed by an endoscopic procedure or any other interventions, which can be diagnosed when you consult a specific gastroenterologist. So the common symptoms of acidity are a postprandial burning sensation in your abdomen. So whenever you take your meal, you'll have a severe burning or an irritation in your abdomen. It should be persistent and not relieved unless you take some kind of a neutralizing agent. So that persists from the morning and even continues till the evening. Okay. So that might be there for many days, and sometimes they may be neglected because they think it is a normal problem what we face daily, and that may continue for a long time, leading to some complications we'll mention further. Second thing is early satiety. Because of your acidity, your appetite will go down, and people sometimes don't take food because of the fear for food, followed by some kind of a nausea or vomiting, or any vomiting sensation that might be present in acidity. Which now the common cardinal symptoms of gastroesophageal reflux disease is retrosternal chest pain. What you have a severe irritation in your chest. You might think it is some kind of a muscle problem or a cardiac problem, but that is a most common cardinal feature of a reflux disease, followed by regurgitation. So regurgitation is effortless propulsion of your gastric contents into your chest and your oral cavity. So what happens is your food actually along with acid comes into your mouth and causes severe irritation or discomfort in your mouth, leading to a increased salivation that is called as water thirst. So that is a common symptoms what we see in this. Followed, sometimes people might be having a dysphagia, that is difficulty to take eating. That may be a later symptom of your reflux disease. Some atypical or an extraesophageal symptoms of reflux disease are there, like pharyngitis or irritation of your throat. You might be thinking that is a normal cold or cough, which may be getting a recurrent symptoms, but the more common cause of irritation of your throat, tonsillitis, laryngitis, that is, you have a change in your voice, it is a reflux disease. Some people might be having an asthma. So asthma, one of the cause of asthma is also reflux disease that has to be evaluated by a physician or a gastroenterologist, because this, if you treat reflux disease, your asthma cure also might be might occur. Rarely it leads to complications. So before the invent of the common medications we were mentioning further, very commonly they used to present it emergency unit with the surgical complications like perforation. So they used to cause ulcers in your stomach or your intestine, leading to an emergency admission and an emergency operation. But it is even common nowadays because in some people who are neglecting these symptoms, and they may be having a surgical complications like an ulcer leading to a perforation, leading to bleeding, severe bleeding. You might be needing an emergency admission and an emergency transfusions, or sometimes it may progress into a cancer also. So that is the reason these are all the spectrum of symptoms in your acidity. These common symptoms, if they are irritating or persisting for more than 4 weeks, you would definitely, commonly you take a over the counter medication or a home remedy for relieving it. But if they are persisting more than 4 weeks, it is definitely advised to take a physician's or a gastroenterologist consultation. But there are alarm symptoms. So alarm symptoms might be telling you that you have a problem or a complication or even a underlying malignancy. So they are, if the person is more than 45 years, if you're having symptoms, these symptoms are starting after 45 years, with a short history with weight loss, patients having any abdominal discomfort or a lump, patients having anemia, which may be present with weakness, easy fatigability, patients having symptoms with blood loss. Sometimes there may be blood in the vomitus, or it may be passing black colored tarry stools, that is called melena. Patients having family history of cancer, or patients having any other significant weight loss. So these are the symptoms that is alarming, and you should definitely get an endoscopy done, because these have to be they have to be evaluated immediately. Sometimes a causes of acidity may be a hypertonia, where your stomach may be herniating into your esophagus. So this is one of the surgical causes which may be easily managed and treated with a surgical operation for this patient. So aerated drinks are nothing but carbonated drinks. So any water with infused carbon dioxide. So this has an acidic effect on your stomach. So whenever you want to relieve your acidity problems, you need a neutralizing agent, that is an alkali for an acid. But this carbonated drinks actually cause immediate temporary soothing effect of your stomach. But you should not take carbon dioxide because it increases your acidity and further activates. So one of the major cause of your acidity is carbonated drinks, and it causes severe reflux disease leading to complications also. So there are some other do's and don'ts of relieving acidity. So do's is take regular food habits, because there is a biological clock in your body. So which says that you should take a meal at a specific time. So one study actually showed that if you take breakfast at 6 o'clock in the morning, lunch at 12 o'clock or 12:30, followed by dinner at 6:30, these people are having good, very are considered very healthy, and the long term follow up of these people are considered good without any gastric problem. So specific timings of food should be taken, and that should be religiously followed for any person to relieve the symptoms. Followed by, if you are taking any meal, that should be small short meals, preferably 5 meals over 3 meals, and that will actually not cause any pressure effects, or causing a large meals itself is a risk factor for acidity. So 5 meals with breaks in between, with the snacking in between, and do not mix water or any carbonated drinks or any alcohol with food, because water should be taken at least 15 minutes before your meal and at least half an hour after your meal, and you should not mix water with any food. And avoiding alcohol, smoking, tobacco, any acidic, spicy food, outside food. If you're ordering a lot of food outside, that is also should be avoided for these people. You have a common, some home remedies which can be used at home is, you can take any neutralizing agent, alkaline product like milk, cold milk, cucumber, kale, broccoli, or any tulsi or ilachi. These home remedies are very helpful and cause immediate relief of your symptoms at your home without any consultation. Acidity, if you it is persisting for more weeks, it is termed as dyspepsia. But this is a chronic disorder which may last for many years. It may be present from childhood and persisting since long ages also. But if it is persisting, causing discomfort, you should take a proper a gastroenterology consultation, because one of the major causes for acidity is H. pylori infection, which is seen in a crowded environment. This is a type of infection can be treated properly with antibiotics. So the course of medication what we give is a 14 days antibiotic course followed by 4 days treatment of a PPIs. So PPIs is a proton pump inhibitors. This has changed or revolutionized the treatment of acidity, which has been introduced in 80s. So proton pump inhibitors, they act at the root level of acidity, decreasing your acid production in your stomach. So that has caused a lot of relief in all the patients, and even symptoms are improved drastically. But even if you are not having a symptoms relief at the end of 8 weeks, further evaluation or further evaluation has to be done by a specialist, by a gastroenterologist. But the problem is, majority of the people, they do not take the medication properly. The compliance is the problem. They take for few days and stop it. But this is a course of 8 to 12 weeks, because it is needed for healing of your stomach and the esophagus. And further is the deleterious part is sometimes some people overuse it or abuse it. Abusing over it a long time, over years, might be causing some kind of problems like a gastric polyp or bone deficiency. That has to be consulted with a gastroenterologist, and do not be abused over the counter. Avoid fatty, heavy meals. Take small meals without water. You should have a minimum 3 hours gap after taking a meal and lying down. Even after your lunch or your dinner, there should be a 3 hours gap. That is the minimum time needed for your gastric emptying. Otherwise, what happens is the contents come into the esophagus, cause irritation, and it persists for a few days. So 3 hours gap is very, very needed. So it might be difficult. That has to be followed religiously. Even if having symptoms, what common advice we give you is keep 2 pillows below your head, because it raises your head, and actually that inclination actually causes relieves your symptoms and doesn't cause acidity come into the chest. More than 2 pillows, there are now planks or any ramps that are present with the pets that are actually more beneficial or improving the symptom. But you should always have a gas specialist consultation, and do not because this is a very common problem. And if you neglect this problem, it leads to complications drastically and also might be a cause or a reason for a malignancy also.